It's either gallery view or speaker view, but I think we do speaker view, right? I'll just do,
I think gallery because she needs to make sure we're being active listeners, if that makes sense.
all right. Okay, well, do I have everybody's permission to record you?
Yes.
Yes. All right, so my name is Morgan McVicker, and as a biology student, a thing that I'm pursuing is a medical field. So the controversy that I've been really exposed to is physician-assisted death. US Legal, an online legal information site, defines physician-assisted death as voluntary termination of one's own life by taking a lethal medication with the direct or indirect assistance of a physician. It's also referred to as active euthanasia. It's used with extremely sick and suffering patients who are 18 years of age or older and have less than 6 months to live. Medical News Today classifies euthanasia into voluntary, non-voluntary, and involuntary euthanasia. So voluntary is basically when the patient gives consent to the physician to go through with the procedure. Non-voluntary is when the patient is unable to give consent, so an appropriate person does it on behalf of that suffering patient's life based off their quality of life. And then involuntary is when no consent is given, but the procedure is still done, and that's called murder. So that's not what we're talking about. And then they also classify it into passive and active. Passive is when life-sustaining treatment is withheld from someone, so basically when they're on like life support or something like that, and then the physician takes it away, and then they die. So that's passive. And then active is when someone uses a lethal substance to end a patient's life, whether by the patient or like the physician will administer it. And that's pretty much what we're talking about today is active euthanasia. People want to pursue this procedure because it like puts them in control of their own life and their sickness. At this point of the patient's life, it's they don't have like a lot of other options. They're seeking palliative care when they're showing significant suffering. A lot of the times it's people with cancer or any kind of other chronic or life-threatening conditions. Palliative care, if you don't know what that is, it's like a special nursing care for people who provide them relief from their symptoms and pain, like their stress physically and mentally. A lot of the times they use opioids for this kind of care, which is like used to manage pain, but it can also cause drowsiness, nausea, vomiting, and constipation. And as I'm sure you know, like an opioid epidemic that we have, it's like super addictive and an overdose can be life-threatening. Palliative care can also be extremely miserable and expensive for the family and the patient. Euthanasia laws like vary from state to state. So Fine Law, another like legal website, defines South Carolina current law about euthanasia as euthanasia or mercy killing is not condoned or authorized by South Carolina law, nor any act or omission other than to allow the natural process of dying. So currently South Carolina does not legally allow euthanasia. Oregon was the first state in 1994 to pass euthanasia with the Death and Dignity Act, and it was enacted in 1997. Since then, 1,100 people have obtained the prescription, like the life-ending prescriptions, and 750 of those people have taken them. Most people were dying of cancer and feared a loss of autonomy, dignity, and the decreasing ability to participate in like day-to-day activities that make their life enjoyable. The New York Times wrote an article 20 years later about Oregon's success with this law, based off of like neutral data and collections and reportings from this process in Oregon. They quoted they overwhelmingly found it worthwhile and the process worked very sensibly and fairly. So they were like good proof that this was really successful. They were so successful because of the safeguards that they put in place. So things like you had to be mentally healthy, you had to be a resident of Oregon, you had to be 18 years or older, and 2 physicians had to like tell you that you had less than 6 months to live. The safeguards ensure patients are making a voluntary and informed decision. So physicians have to educate them on all the options, such as like palliative care, like I mentioned earlier, pain management, and hospice. They have to make 3 separate requests. So 2 oral and 1 written. The 2 oral have to be separated by 15 days, and then the written one has to be witnessed independently by 2 people. To ensure that they aren't going back on their decision, they're allowed to change their mind at any time or stop the process. And then to make sure they are in control of the process at all times, they actually are the ones who administer the medication themselves. The New York Times says that the data shows no signs of negative impact on the physician and patient relationship, which is good, and that in short, Oregon has so far been like a really big success. So because of this, a lot of states have followed in Oregon's path, such as California, Colorado, the District of Columbia, Hawaii, Maine, New Jersey, Vermont, and Washington. So they all allow physician-assisted death now. The Post and Courier, which is another newspaper, wrote an article about Bob DeVay, a South Carolina man with a terminal cancer who sent like a plea to South Carolina lawmakers in order to get physician-assisted death. He explained that he was diagnosed with mesothelioma, a rare terminal cancer in the lung cavity, that there was no cure. He was originally sent in to do like a drug trial at MUSC, but when the cancer spread to his spine and all over his body, he was unable to walk and couldn't do the trial anymore. His cancer was too aggressive. So then at this point, physicians concluded that there was nothing to be done. They couldn't really help him anymore. He could do palliative care to kind of help with the process, but it wouldn't be super nice. And he said in his letter that 4 different kinds of painkillers he takes are not helpful, and that the pills only fix so much of the pain and anxiety. So he was still suffering even though he was in this palliative care. He was left with hospice. He could move to another state that allows physician-assisted death, or he could do nothing at all and just kind of suffer the last few months of his life. The main reason we don't allow physician-assisted death in South Carolina is because it goes against a lot of people's religious beliefs. But Bob makes a good point in his letter when he says that the First Amendment of the U.S. Constitution clearly delineates a separation of church and state, and that we conveniently ignore it for end-of-life decisions. So basically he's saying here that like the First Amendment says that we should be separating church and state, so like our religious beliefs and what our laws are in the US, but he's ignoring, or like we're kind of ignoring that First Amendment when it comes to this law because it's going against religious beliefs, and that's the only reason we're not doing it. So Bob is a great example of someone who is suffering physically and mentally to stay alive. He is left with minimal options, and he feels like he's out of control of his own life. His friends and family are going to remember like the last few months of his life of him just being really suffering and upset. Patients like Bob want to die with dignity before their life, like quality of life, is diminished. And physician-assisted death can provide kind of closure for friends and family like Bob's, so he can go in a more peaceful way and suffer less. I believe that this law needs to be passed in the state of South Carolina in order to help patients like Bob who are terminally ill and suffering. So we can do a little discussion about that. So one of the questions I had was, if euthanasia was legalized in South Carolina, do you guys think that every physician should be required to perform physician-assisted death, or do you think it should be based off of like each physician's like ethical decision and like beliefs?
I feel like maybe ethical decision and belief, just because I feel like not like every physician assistant may not like be comfortable doing that, but that's
Yeah.
It's kind of hard to force doctors to go against like their own values and like take away their own like personal beliefs and freedoms because of a law. So that's a big like controversial issue.
Mm-hmm.
I agree. I think that also I think about most private practices have like a lot of doctors, like 3 or 4 doctors in them. So I think it would be more up to like the private practice in itself rather than like the state in general.
Yeah, that's a good point. And then do you feel like the safeguards I talked about that like Oregon had, how it talked about like how all the things like 2 oral requests and like 1 written, all that kind of stuff, do you feel like those like regulations are enough to go through with the procedure, or do you feel like they should do more stuff before they act on the procedure? If that makes sense.
I think it's good because it's enough to know exactly what each person, that the person's actually like sure that this is what they want, you know?
Mm-hmm.
a big issue used to be if they were in like the right state of mind. And I really like how there's a policy to make sure that like this is what I want. Like I'm clear enough to say this is what I want for my life, and like it's not just because I'm so depressed or anything. Like I'm dead set.
Yeah. So just as like my final like wrap up question, do you guys think that South Carolina should pass this law, or do you think it should stay the way it is right now?
I think they should.
Yeah, I think they should too.
I think they should.
I agree too.
Okay, cool. All right, guys, thank you so much.
Bye. Thanks.
Bye.
Okay.